Hello people, in this video we want to look at this topic, triple deformity of knee. We are in orthopedics and trying to look at what are the three deformities in knee, which you can see here. There is flexion at the knee, there is external rotation or lateral rotation of the tibia, and there is posterior dislocation, right? Subluxation or dislocation, yeah, subluxation of the knee, posterior subluxation of the knee. So you can see the knee has kind of gone posterior. So you can see here, what are the three things that are that you can see? Flexion of the knee, show the flexion of the knee, external or lateral rotation of the tibia, external or lateral rotation of the tibia, right? Then posterior subluxation of knee. So the knee, you can see it is not looking like a normal joint, right? There is some subluxation of the knee, right? Posterior subluxation of the knee. Posterior subluxation of the knee. So this is the triple deformity of knee. Where will you see it? You will see it in tuberculosis knee. You can also see it in severe or late stage polio, that is residual paralysis. In that you can see this triple deformity of knee. Okay. Now what are the three deformities you have understood? Treatment we can come to later. First look at the X-ray here. Can you see in X-ray what do you see? Flexion. Flexion is, everybody is able to see flexion. Lateral rotation. Lateral rotation. Hard for us to make out actually. Yeah, it has gone this side I feel. Lateral rotation and posterior subluxation of the knee. Okay. So we are able to see this features in X-ray. Okay. So in tuberculosis of knee you will have to explain everything. It is caused by what? Mycobacterium tuberculosis. All that you can write to get extra points. Mycobacterium tuberculosis will cause tuberculosis in a person. Here what will happen, there will be synovitis, right? Basically, how is this bacteria going to attack? So it will begin in the bone, okay? This begins in the bone. It's like the femoral or the tibial condyles, okay? So obviously the condyles, you can remember, condyles of the femoral or the tibial condyles, right? It will begin here, and then synovial membrane it will attack. Synovial membrane, who is attacking? The tuberculosis bacteria, right? We are telling you everything about TB knee here, okay? Focus. So there will be synovial tuberculosis. There will be hypertrophy of synovium, okay? And initially there will not be much damage, okay? But you can see initially there will be flexion deformity. Flexion deformity is there. Later this triple deformity will come. Triple displacement is the word they are using. Flexion, external rotation and posterior subluxation, that we already told you. Flexion, external rotation, posterior subluxation. All this happens because of ligament laxity. Later there will still, further if you leave it, there will be damage to the articular cartilage, hypertrophied synovium, right? Bone is destroyed, pus can be there in the joint, right? And that triple displacement, same thing we already told you. Clinical features, how will the patient present? He can present with synovitis, swelling, muscle atrophy, cold abscess, sinus. Cold abscess in the neck you have heard, right? Similarly, very similar, then sinus, then deformity we told you, triple deformity. Movements are also limited, okay? Movements are limited. There is pain and muscle spasm on attempting to move. So this is how the patient will present, okay? Then, what will happen with time? With the time, the patient's deformities will become permanent because there will be contracture of the soft tissues and maldevelopment of the bones in the deformed position. So this can become permanent, okay? That is very bad, right? Then, how will you treat? Now let's get to treatment. How will you treat? Now TB treatment, you know those antitubercular drugs, ATT you will talk about, that is isoniazid, rifampicin, pyrazinamide and ethambutol. Then care of the knee, basically you will rest it by applying skin traction. So they're talking about skin traction here, standard things in orthopedics, above the knee POP, slab, okay? So basically they are resting the knee. You rest the knee, they are saying, by putting all this, okay? And then this helps in the healing process. So much of the pain can also go, right? Then operative treatment, guys. So you have something here called as synovectomy. You can do synovectomy. So if it is purely a synovial tuberculosis, synovectomy. So you will see some melon seed bodies within the joint. Joint debridement you can do. So basically you are draining the pus. The pus is drained, the synovium excised, and all the cavities are curated. Okay, this sounds nice. You're just debriding everything that is there, all the pus and all. Arthrodesis is fusion of the joint. So this they will do only if nothing else works. So they will put it in a functional position, or this position that they are saying is 5 to 10 degree of flexion and neutral rotation. This is the position in which they will fuse the joint. So you cannot move the joint. Okay. This only they will do if you cannot do anything else. Okay. This is, they have some Charnley's compression arthrodesis. If you want, you can remember that. Then nowadays they have some minimally invasive arthroscopic surgery, etc. Fancy things that you will write for almost everything in orthopedics. You write this minimally invasive arthroscopic surgery for joints. Okay. This is the plan of treatment looks like. Let's see this. So here is our knee, and let's see what they want to do with it. So tuberculosis knee, you know that it is there. Okay. So what will you do now? You will do anti-tubercular drugs is the first thing they're talking about. Then you can do skin traction so that you will allow the knee to rest, right? So there will be relief of pain and muscle spasm. There will be relief of pain and muscle spasm. Then you will repeat X-ray because you've done skin traction and given ATT drugs. You will repeat X-ray. What will you see in X-ray? No or minimal joint irregularity. That means it's kind of healing. Then you can ask them to mobilize the knee and get back as much function as possible because it has kind of recovered, right? But even after this, if there is severe joint destruction and subluxation, then what will you do? You will try to fuse the joint, right? So you will do long leg cast till fusion occurs, or you will do arthrodesis. Okay, the compression type. What was that name? Charnley's compression. Okay. So this is the treatment for tuberculosis knee. Then lastly, if it was caused by polio, if this triple deformity was caused by polio, what and all polio you can give polio, any treatment for polio? Basically polio you have to talk about prevention, okay? All the oral polio, injectable, fractional IPV, all that you have to talk about. These are calipers, okay? Then you can do splinting of the paralyzed part in such a way that you can get back the balance, okay? Tendon transfer also for balance, okay? So just three things they have told here: caliper, splint, tendon transfer, Wilson's release. They are talking about a specific technique called as Wilson's release, that is tendon transfer, okay? So this is all about triple deformity of knee. Let's take a recap. Triple deformity of knee means what will happen? There will be flexion at the knee, external and lateral rotation of tibia, and posterior subluxation of the knee. This you will see in tuberculosis and in late polio, that is post-polio residual paralysis, that is PPRP. So basically in the X-ray also you can see those things, that is the flexion, lateral rotation of the tibia, and the posterior subluxation of the knee. So basically this tuberculosis is by Mycobacterium tuberculosis. Initially it will affect the bones, especially the condyles, then the synovial membrane. Okay. So initially there will be flexion deformity of the knee, then there will be flexion, external rotation, and posterior subluxation. That is nothing but the triple displacement. All this happens because of ligament laxity. Then you can see damaged articular cartilage. The bone gets destroyed. There is pus in the joint. There can be hypertrophied synovium. So the presenting complaints can be pain, synovitis, swelling, muscle atrophy, cold abscess, sinus deformity, movement restriction, etc. Pain, muscle spasm, etc. So what will you do? You will take that X-ray like we showed you, and you will do anti-tubercular test and all that. So basically, if you leave it like this, what will happen? The patient deformities can become permanent. Okay. So anyways, now how will you treat? You will give anti-tubercular drugs. You will put the knee in rest using skin traction or slab, right? And then you can also think about synovectomy, joint debridement. When you do synovectomy, you can see melon seed bodies within the joint. Joint debridement, you can remove the pus, etc. Arthrodesis, where nothing works, you can fuse the joint like this. Charnley's compression arthrodesis, and then nowadays there is minimally invasive arthroscopic surgery. This is the flow chart. Basically, you'll give antitubercular drugs. Hold on, you'll give antitubercular drugs and skin traction and rest the knee. After all this ATT, you will check X-ray again. If everything is fine, then you will mobilize the knee, etc. But still, if it is not fine, if there is severe joint destruction, etc., then you will have to think about fusing the joint, which can be conservative with a long leg cast, or you can do an arthrodesis, compression type, Charnley's. Okay. When it comes to polio, you can give calipers, etc. You can splint, or you can do tendon transfer. That is Wilson's release. Basically, here they are more concerned about the balance. Okay. That's it for now in this video on triple deformity of knee. Bye-bye.